Good afternoon, my name is Xiao Hu. Today we're going to talk about primary discharge teaching. Objective: enhancing medications communications, promoting medication adherence, facilitate seamless care transitions, and increasing patient state satisfaction. My PQUAC questions: in oncology unit, how does assigning a primary discharge nurse to conduct discharge teaching compared to patients without receiving the primary discharge teaching affect the HCAP score in medication communication? Background and significance. In the United States, the HCAP survey assesses patients' perspectives on their hospital experience, including medication communication. Improving medication communication score in the HCAPS survey is not only important for patient satisfaction, but also reflects the quality of care provided by the healthcare organizations. I have noticed that the HCAP score of our unit are nearly perfect except for the categories of medical communications. It has been the lowest sections of all, and it inspired me to bring out the proposal of primary discharge nurse education program to improve the current obstacles. Designating a primary discharge nurse can potentially benefit both the clinical organizations and nursing practice in several ways. By providing consistent medication education and ensuring effective communications, patients are more likely to understand their medication region, adherence to prescribed treatment, and experience better health outcome. Effective medication communication contribute to higher patient satisfaction score on HCAP surveys. This can positively impact the reputation of the clinical organization and potentially attract more patients. Clear medication instructions and education provide a primary discharge nurse can reduce medication errors and subsequent readmission rate. This can lead to cost saving for the organization and better patient experience. In acute setting, it is estimated that 40% to 80% of what is taught to patients is forget immediately following teaching, and the 50% of the information the patient do remember is recalled incorrectly. Assigning a primary discharge nurse allows for specialization and expertise in discharge education and medication communication. Nurses can develop proficiency in these areas, contributing to professional growth and improving overall nursing practice. Goals. There are many goals when it comes to include a discharge nurse both for the patients and for the hospital. By staffing a discharge nurse, it allows the nurse to give the patient more one-on-one time to go over their discharge paperwork and for the patient to ask any questions. This is said to help increase the knowledge and medication compliance of the patient. By giving the patient more one-on-one time with a discharge nurse, it is said to help improve patient satisfaction score and reduce readmissions rate that could be costly to the hospital and to the patient. Our literature review. Many of the studies we research use a method of having a designated discharge nurse, checklist for discharge readiness, and follow-up phone calls after discharge. One study even made sure that each patient had at least 4 hours of discharge education prior to being discharged. Each study emphasized that it would improve clinical outcome, increase HCAHPS scores, and increase medication compliance. Every study found that by adding those interventions list, it did everything hypothetically more. All found increased patient satisfaction scores, some found reduced death and readmissions rate. Even one found that individuals were more likely to follow up with their PCP as needed. One study shows that from February through July 2018, medication communication HCAHPS score increased from 33.3% to 95% with the primary discharge teaching. The HCAHPS score related to teaching the patient about the purpose of new medication increased from 62.5% in February to 100% in July. Score for steps describing possible side effect increased from 12.5% in February to 71.4% in July. This success was attributed to the interventions method above. One study focused on if the use of the transitions nurse who checked discharge readiness, provide the discharge instructions, and did a 72 hours discharge phone call would increase discharge outcome. The addition of a program in which a primary nurse was assigned to a nurse to focus on discharge nursing helped the patient to be more likely to comply with the discharge teaching that was provided, and as a result lowered the 30 days mortality rates of the patients involved in the study. The addition of 1 hour nurse educators delivered teaching sessions at the time of hospital discharge result in improved clinical outcomes, increased self-care measures adherence, and reduced cost of care in patients with systolic heart failure. However, assigning a primary discharge nurse requires more resources, such as staffing, time, and training. Limited resource or compassion's priority with healthcare organizations might present challenges in implementing and sustain the role. Understand resource allocated implications and potential barriers is essential for success implementations. Proposal plan descriptions. Stakeholders are individuals, groups, or organizations who have interests or stake in a particular project, initiative, organization, or decisions. Patients are a key stakeholder group impacted by the assignment of a primary discharge nurse. The proposal aims to improve medications communication, leading to better patient understanding, adherence to medication regimen, and overall satisfactions. By receiving constant and personal medications education, patients can make informed decisions about their healthcare, leading to improved health outcome and a better patient experience. Primary discharge nurses are stakeholders who will be directly impacted by the proposal. They will have an expanded role in the medications, educations, communications, and patient advocacy. This proposal can provide professional growth opportunities for nurses, allowing them to develop expertise in discharge planning and medications communications. It may also lead to increased job certifications and a sense of fulfillment in providing comprehensive care to patients. Healthcare administrations and leaders within the organizations have a stake in the successful implementations of the proposal. By designating the primary discharge nurse, they can demonstrate their commitment to patient safety, quality improvement, and patient satisfaction. These interventions align with the organization's goal of providing excellent care. It may also contribute to a positive reputation for the healthcare organizations and potentially financially benefit. Overall, the proposal impact on these stakeholders will contribute to better patient outcome, improved patient experience, and a more efficient healthcare system. Implications. Assess the current medication education process and patient's outcome to determine the need for improved medication education. This can be done by designing a comprehensive curriculum that covers essential topics, including medication safety, communication skill, patient education techniques, common medication, and potential side effects. Determine the necessary staffing level to support the primary discharge nurse role based on patient's volume and acuity. Allocate resources such as time, training, and technology to enable effective medications, communications, and educations. Foster collaborations among healthcare providers, including physician, pharmacy, and other members of the care team. Establish effective communication channel and process to facilitate seamless information transfer and coordination of care being unit meeting. Provide comprehensive training to primary discharge nurse on medication communications, patient education technique, health literacies, and cultural competency. Work with the education department to add some medications module as annual competencies to refresh the nurses' knowledge regarding medication education. Additionally, offer education to other stakeholders such as healthcare provider about the roles and responsibility of the primary discharge nurse and the importance of effective medication communications. Develop mechanisms such as discharge purchase package to monitor and evaluate the impact of the primary discharge nurse role on medications communication scores, patient outcomes, and certification. Utilize checkbox to make sure all discharge requirements are met before discharge. Regularly assess the effectiveness of the intervention and make adjustments accordingly based on patient's review and feedback. Finding. Key finding displays that one-on-one discharge teaching improve clinical outcomes and self-care measurement. There are many different methods to medications discharge education, and it is important as a nurse to organize and personalize your medication discharge education as appropriate for your patient. It is important to build rapport with your patient as it leads to increased willingness to listen and learn. And it is important to encourage questions prior to discharge and provide written information for patients to reflect on when questions arise after discharge. The addition of a 1-hour nurse education delivery teaching sessions at the time of hospital discharge result in improved clinical outcomes, increased self-care measurement adherence, and reduced cost of care in patients with systolic heart failure. A systematic reviews and meta-analysis were conducted to identify the effectiveness of discharge educations using teach-back method. We found that discharge education with teach-back method reduced 30 days readmission rate by 45%. The detailed method for the systolic review and methodology are described in our previous work. Evaluations. The presence of a primary teaching nurse specialized in medications communications could facilitate improved care coordinate during the transition from hospital at home. This outcome would involve better communications and collaboration among the healthcare provider, leading to a smoother transfer of information and improved continuity of care for patients. Data collecting would involve collecting revolvement information before and after the implementations of the primary discharge nurse role. This could include the quantitative data such as medications communication score from the HCAP survey, patient certification survey, readmission rate, and medication error rates. As shown on the graph above, we can see a correlation of using the discharge nurse reinforced medication educations and an increase in scores 55.3 in April to 59.5 in May and 66.7 in June 2023. Limited staff time and financial resource may present challenge in implementing and sustaining the primary discharge nurse role. Adequate resource allocations and prioritize will be essentials to overcome the barrier. Resistance from healthcare provider, administration, or other stakeholders may arise due to concern about workflow disruptions or role overlap. Addressing this concern through effective communications and collaborations is crucial to gain support for the proposal. Conducting comprehensive evaluations and monitor process can be resource intensive and challenging. Ensure long-term sustainability of the primary discharge nurse role and maintain continuous quality improvement efforts may require ongoing commitment and dedications from the organizations. From patient-wise, sometimes it's hard to follow up with internet, and language barrier is something that we have to consider as well. Dissemination, uh, disseminating the project outcome within the healthcare organization itself can be achieved through internal forums such as grand rounds, department meeting, or quality improvement presentation. Sharing the result with colleagues and healthcare professionals within the organization can facilitate knowledge transfer and promote pretentious implementations within other units of departments. Prepare a detailed proposal that outlines objective, content, and anticipate outcome of the continuing education presentations. Align the proposal with the organization's target audience and learning objective, emphasizing the relevance and applications of the project finding to nurse practice. Reach out to the identified provider, Lauren, and establish communication to discuss the possibility of delivering a continuing education presentation based on the project. Also, we can submitting the project result as a research article to a reputable nursing or healthcare journal for the publications can reach a wide audience, including nurse, healthcare professional, and researcher. Collaborating with a nurse associate or organization to offer the project finding as a continual education course can provide nurses with the opportunity to earn CEUs, ensuring widespread dissemination and application of evidence-based practice. Utilize the social media platform and blogs, YouTube to share key findings and insight, reach a broader audience, and encourage engagement and discussion. Summary. The purpose of the capstone project is to explore the impact of designating a primary discharge nurse on medication communication score, specifically focus on the hospital consumer assessment of healthcare provider and systems. HCAPS. Medication communication plays a crucial role in patient safety, adherence to treatment plans, and overall satisfactions with healthcare expertise. By assigning a primary discharge nurse, healthcare organizations aim to improve medication education, enhance patient understanding, and optimize the post-discharge medication management. Thank you, everybody. Have a nice day.